Digestive problems, causes and symptoms. Common digestive issues include constipation, diarrhea, bloating, and the feeling of an unfinished bowel movement. These are often symptoms of different digestive disorders such as irritable bowel syndrome or IBS, ulcerative colitis, and Crohn's disease. Digestive issues such as diarrhea, bloating, and constipation are very common. There are a number of reasons why a person may be experiencing them. In this video, we outline several conditions that may cause digestive issues and list their symptoms and causes. Irritable bowel syndrome or IBS. IBS is a common condition that affects the digestive system. According to the American College of Gastroenterology or ACG, IBS affects an estimated 10 to 15% of people in the United States, but only 5 to 7% of adults have received a diagnosis. Symptoms of IBS. Common symptoms of IBS include abdominal pain, diarrhea, constipation, bloating, feelings of unfinished bowel movements, white mucus in the stool. A person with IBS may experience these symptoms without having any damage or disease in their digestive tract. IBS symptoms can appear in flare-ups, which can last for several days. Between flare-ups, a person may experience periods of remission, during which they have no symptoms at all. Causes of IBS. The causes of IBS are unclear. Some experts believe that microbial factors play a role in the development of the disorder. According to the 2017 review of 45 studies, just over 10% of people who experience food poisoning develop IBS later in life. Experts also believe that problems with the way the brain and the gut interact can affect how the digestive system works and may cause IBS symptoms. According to the National Institute of Diabetes and Digestive and Kidney Diseases, the following problems are common in people with IBS and may cause IBS symptoms: stressful early life events, including physical or sexual abuse, depression, anxiety, and somatic symptom disorder, bacterial infections in the digestive tract, food intolerances or sensitivities to certain foods. Small intestinal bacterial overgrowth or SIBO. SIBO is a common gastrointestinal disorder. The large intestine tends to have higher levels of bacteria than the small intestine. This is because gastric acid secretion and intestinal motility limit the overgrowth of bacteria within the small intestine. If these two protective mechanisms against excessive bacterial growth stop working, a person may develop an excess amount of bacteria in their small intestine. Symptoms of SIBO. SIBO symptoms are similar to the symptoms of other digestive disorders including IBS and lactose intolerance. Common symptoms of SIBO include stomach pain, bloating, diarrhea, constipation, nausea, unintentional weight loss. Causes of SIBO. An imbalance of bacteria in the small intestine causes SIBO. Excessive bacteria can develop after bacteria travel to the small intestine from another part of the gastrointestinal tract, or when naturally occurring bacteria in the small intestine multiply. Gastroesophageal reflux disease or GERD. Acid reflux occurs when acid from a person's stomach rises into their esophagus. If a person experiences acid reflux regularly, they may have GERD. GERD is one of the most common gastrointestinal diseases and affects an estimated 20% of people in the United States. Symptoms of GERD. The main symptom of GERD is heartburn. This is a feeling of discomfort or a burning sensation in the chest. Heartburn can become worse if a person lies down or bends over. It may also become worse after a person has eaten. Other symptoms of GERD include nausea, vomiting, bad breath, respiratory problems, difficulty or pain when swallowing, tooth decay. Causes of GERD. Occasional acid reflux is common. However, if this issue occurs frequently, a person may have GERD. The main cause of GERD is the weakening of the sphincter at the bottom of the esophagus. When this becomes weak, it opens when it should not. This allows stomach acid to rise into the esophagus. Common factors that can cause the sphincter at the bottom of the esophagus to weaken include having overweight or obesity, pregnancy, smoking or inhaling second-hand smoke, taking certain medications, and non-steroidal anti-inflammatory drugs. If a person has a hiatal hernia, they are also at increased risk of developing GERD. A hiatal hernia can cause the opening in the diaphragm to allow the upper part of the stomach to move into the person's chest. Ulcerative colitis. Ulcerative colitis is a form of inflammatory bowel disease or IBD. It is a chronic, long-term condition that causes inflammation in the colon. If a person has ulcerative colitis, abnormal reactions of the immune system cause inflammation in the colon. Ulcerative colitis may also cause ulcers to form. A person may develop ulcerative colitis at any age. However, it typically develops in person ages 15 to 30 years. Symptoms of ulcerative colitis. Ulcerative colitis symptoms can vary from person to person. Around half of people with ulcerative colitis experience mild symptoms. Ulcerative colitis often causes digestive issues. Common digestive symptoms include the urge to have bowel movements when the bowel is empty, loose bowel movements, bloody stools, abdominal cramps and pain, diarrhea. Ulcerative colitis symptoms often appear in flare-ups. Flare-ups often occur between periods of remission. When a person is in remission, they may experience very few symptoms or no symptoms at all. A person has ulcerative colitis, they may also experience symptoms unrelated to their digestion. This include fever, fatigue, loss of appetite, weight loss, nausea, low red blood cell count or anemia, delayed growth and development in children. Causes of ulcerative colitis. Ulcerative colitis is an immune disorder. This means that a person's immune system attacks the body's own cells. If a person has ulcerative colitis, their immune system attacks cells in the colon, causing inflammation. This may also cause ulcers to form. The inflammation and ulcers then cause symptoms of ulcerative colitis to develop. Medical professionals do not entirely know what causes this abnormal immune response. However, experts believe that the following factors may increase a person's risk of developing ulcerative colitis. Genetics. Sometimes ulcerative colitis occurs in families, so having a close relative with ulcerative colitis may increase a person's risk of developing it. Microbiome. Certain bacteria, viruses, and fungi in the digestive tract may increase a person's risk of developing ulcerative colitis. Environmental factors. Environmental factors such as diet, smoking, and air pollution may influence a person's chances of developing ulcerative colitis. Crohn's disease. Crohn's disease is a form of IBD. An abnormal immune response causes inflammation to occur in a person's digestive tract. Crohn's disease can cause inflammation in any part of the gastrointestinal tract, including the esophagus, stomach, small intestine, and colon. It affects an estimated 3 million people in the United States. Symptoms of Crohn's disease. Crohn's disease can cause a number of gastrointestinal symptoms including diarrhea, rectal bleeding, the urgent need to have bowel movements, abdominal cramps, abdominal pain, the sensation of an incomplete bowel movement, constipation. Symptoms of Crohn's disease often appear in flare-ups between periods of remission. When in remission, a person may not experience any symptoms at all. Crohn's disease may also cause a person to experience symptoms unrelated to their gastrointestinal tract. This include anemia, red eyes, painful eyes, fatigue, fever, joint pain or soreness, nausea, loss of appetite, skin changes such as discolored, tender bumps under the skin. Causes of Crohn's disease. Like ulcerative colitis, Crohn's disease is an immune disorder that causes the immune system to attack the bowel's own cells. Common factors that can increase a person's risk of developing Crohn's disease include genetics. If a person has a parent or a sibling with Crohn's disease, it increases their risk of developing this disease. Smoking. Smoking can more than double a person's chances of developing Crohn's disease. Diet. A high-fat diet may increase a person's risk of developing Crohn's disease. Medications. Some medications such as non-steroidal anti-inflammatory drugs, antibiotics, and birth control pills may slightly increase a person's chance of developing Crohn's disease. Food intolerances. If a person has a food intolerance, they find it difficult to digest certain foods. Food intolerances are different from food allergies. A food allergy involves the immune system reacting to a specific food, but a food intolerance usually involves issues with the digestive system, not the immune system. Symptoms of food intolerances. Food intolerances affect people differently. Common gastrointestinal symptoms of food intolerances include bloating, excess gas, stomach pain, diarrhea, constipation. Specific food types can trigger symptoms. The severity of the symptoms can depend on how much of the trigger food a person has eaten. Other non-gastrointestinal related symptoms of food intolerances include migraine episodes, headaches, a runny nose, a general feeling of being unwell or run down. Causes of food intolerances. Food intolerance often arises due to the body's inability to digest certain foods. This may be due to a lack of specific digestive enzymes or the body's sensitivity to certain chemicals. Common food intolerances include milk and dairy products, gluten, fructose, food colorings and preservatives, sulfites, other compounds such as caffeine and fructose. Other conditions that may cause or contribute to gastrointestinal issues. A number of other conditions may cause gastrointestinal issues. This include certain cancers such as colon cancer, viral infections such as norovirus, and viral gastroenteritis, bacterial infections such as E. coli and salmonella, food poisoning, hormonal diseases such as Addison's disease.